Have you ever suffered from pain around your kneecap, and have you ever wondered what could be causing it and how do I get rid of it? My name is Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And for today's quick tip episode, we're going to be talking about the causes of kneecap pain. So in this video, I'm going to give you the 3 most common causes of kneecap pain and what we can do to help them. So the first and by far the most common cause of kneecap pain in over 50s is something we call patellofemoral irritation. So patella means kneecap, femoral means the femur, which is your thigh bone, and irritation just means any issue that causes inflammation or irritation around this sort of general region. Now, patellofemoral irritation is the most common cause for kneecap pain or pain around the front of the knee. And typically what it can cause is achiness or sharp pains when you're walking, when you're coming downstairs, and it can cause clicking, it can cause swelling, it can even cause sometimes the knee to give way, and it can be really unpleasant. And the funny thing about patellofemoral irritation is usually if we were to x-ray or scan your knee, we wouldn't see a huge amount wrong on the pictures. The pictures would look okay. And the reason for this is it's not an injury as such, but it's irritation to this area that occurs over time. And it usually occurs because the kneecap isn't quite moving up and down in the groove that it was designed to move in. So on the femur, which is your thigh bone here, we have a very well-defined groove that the kneecap moves up and down in. Okay, this is in an ideal world. Now in reality, if we end up with some muscles that aren't strong enough and other muscles that are too tight, instead of moving directly up and down, the kneecap will slightly track either to the left or the right. And this causes irritation around the very sensitive structures at the front of the knee. So that's the most common cause of kneecap pain, patellofemoral irritation. Now the second and also very common cause of kneecap pain is arthritis in the patellofemoral joint. Now arthritis just describes the process that occurs with age, which leads to a loss of cartilage in the joint. And cartilage is the structure or the substance that basically lubricates all of the joints in our body and helps the joints to move freely. Now we have a layer of cartilage underneath the kneecap, and we have a layer of cartilage on top of the thigh bone here. So the bones sandwich the cartilage together, and you have a nice plump layer of it here so that when movement occurs, usually there's no friction. Now, as we get older, we can develop wear and tear to this cartilage, and that cartilage can get thinner and thinner, which means the bones come closer together. And then in some movements, that can lead to the bones becoming too close for comfort, and it develops into a painful problem. Now, patellofemoral arthritis is more difficult to treat, but it is treatable. We treat it in quite a similar way to how we treat the irritation between the joint, and that would be to loosen up any tight muscles and to strengthen up any weakness. Now, if you've got weakness around your knee or your hip, then it leads to the knee joint not moving as it was designed to move, and that can irritate both of these problems. So conversely, if we strengthen up the weaknesses and we release the tightnesses, that usually leads to an improvement in the symptoms of both of these problems. So those are the first and most common types of kneecap pain. You've got patellofemoral irritation and arthritis behind the kneecap. The third common condition that can cause kneecap pain is something called housemaid's knee. Okay, and the technical term for this is a pre-patellar bursitis. Now, in front of the kneecap, so right here, we have a tiny little fluid sac called a bursa. And this bursa is almost like if you've seen a screw joint with a washer, it's almost like the washer. So it stops too much rubbing going on, and it's nice and plump, it's filled with water, and it acts as a little buffer basically, so that not too much rubbing happens at the front of the knee. Now, this condition causes this bursa to become very inflamed, and it can often cause a huge swelling at the front of the knee if it's irritated. And it's called housemaid's knee because the typical way to do it is for people who kneel down a lot, so they rub it between their knee and the floor, and then over time this irritation just causes the bursa to become inflamed, and it can swell up like a balloon. So if you've noticed a big lump at the front of your knee and that's giving you your kneecap pain, the most common cause there is housemaid's knee. Now, housemaid's knee is not commonly caused by weakness or tightness. It's a mechanical stress or pressure going through this that caused it. So the main treatments for that are rest, ice, anti-inflammatories, and avoiding kneeling on it until it goes away. If you've got a very large swelling at the front of the knee, well, if you have any swelling, you should get it checked out. But if you've got a very large swelling at the front of the knee, it might benefit from being drained by a doctor or someone else who's trained in that procedure, just to bring the size of it down. So those are by far the three most common causes of kneecap pain. Patellofemoral irritation is not an injury, but it's just the way the joint is moving. It means that the knee's not very happy, so we can fix that with physiotherapy type treatment. Arthritis behind the kneecap, there is a structural issue going on there, but it can also be improved with strengthening and stretching. And then housemaid's knee, that requires more sort of your classic conservative measures like ice and rest, and just not kneeling through it. So those are the three most common types. I hope that video has made sense and it's been informative. If you're suffering from kneecap pain, do feel free to get in touch and we'll see what we can do to help you. You can also take my free guide on knee problems. You will find that below this video. And the other thing I really appreciate you doing is subscribing to the channel and pressing like on this video, because it really helps me to reach more people, and share it with your friends if you're happy to do so as well. Anyway, thank you very much for watching. The other thing you can do before we go is if you are suffering from knee problems and you want some tips on getting better, you can pick up a copy of my book. It's called Thriving Beyond 50. You can find it on Amazon and all good booksellers. But thank you so much for your time and thank you for watching, and I look forward to seeing you on the next video.